This is an ultrasound study of a female pelvis. Patient age 22 years and history of primary infertility for she's married for the last 3 years. No history of surgical intervention or any other verbal pathology. She came also with the complaint of bilateral lumbar region pain. This is the urinary bladder in transverse section showing is unremarkable, and this is the longitudinal section of the urinary bladder. Now this is the uterus, fundus of the uterus, anterior myometrium. This is the endometrial canal, and the uterus measures approximately 4.7 into 3.2 centimeters, with this being the urinary bladder on the left side and this being the cystic area. This is the cyst on the side, the urinary bladder on the right lateral side of the uterus, and this is the longitudinal section of the uterus. Now, if you see that there is no focal lesion seen relating to the uterus, and the cervix, the vagina, they are all intact, no focal lesion seen. This is the transverse section of the uterus, and in the transverse section we don't see any focal lesion and or any anomaly. However, this being the urinary bladder, when I move the probe anteriorly, I see 2 areas, echo-filled area. Now remember that this is the uterus, this area is the uterus in transverse section, this is the urinary bladder, and this is the echo-filled cystic area. And this cystic area gives posterior wall enhancement. This is the longitude transverse section of the cystic area on the left side, the left adnexa or left ovary. And you can see there is fluid level. This is what is called fluid level, and this is the cyst. This is the cyst, left-sided, sorry. These are the echoes, dependent region, and this is full of echoes. In fact, it has an approximate volume of 80 ml. So this cystic area filled with echoes and seen in the region of the left adnexa is suggestive of Pyosalpinx on the left side, and this is cystic. See the posterior wall acoustic enhancement. There is no calcification seen, and there is no evidence of any solid element within it. No septa are seen. What is seen is that it is well demarcated, is on the left side of the uterus. See, left adnexa. This is the uterus. This is the uterus. This is the endometrial canal. This is urinary bladder, and this is the cyst. Now, when I focus the cyst only, then you will see that it is very well demarcated. However, posterior wall acoustic enhancement is seen. So this is left-sided Pyosalpinx. Now, when this is the urinary bladder, now I am going to take you towards the right-sided cystic area, which communicates with the Now you see this cystic area extends to the anterior to the urinary bladder. This is the urinary bladder. Okay. Now this is the left-sided cystic cyst or Pyosalpinx. It moves towards the right side. This one. This is the right side, and it is full of echo as well. You can see the echoes. This is the transverse section, and this is the longitudinal section of the same cyst, cystic mass. The same features that we were seeing in the on the left side, same features are seen in this. See that the approximate volume, this is the longitudinal section of the echo-filled cyst on the right side, right adnexa, is approximately 267 ml. And this is also consistent with right Pyosalpinx. Note the degree of acoustic enhancement or strong back wall in both. And there is no calcification seen, there is no septa, no solid element seen in this cystic area. Now another interesting thing is that you see this, what is this? This is the ovary. This is the ovary. So the right ovary is intact. We can see the right ovary with developing follicles within it, and this communicates with the large echo-filled cystic area. Here you see that. Okay. This is a relatively better view for you. Now, what has happened in fact, this is the right ovary, this one, and these are developing follicles within it. Now you see there is a breach seen in the ovary. This is a small breach seen, and this has led to the dilation of the fallopian tube leading to Pyosalpinx. So this is in fact the dilated fallopian tube with full of echoes, and consistent with which is consistent sonographically with a right Pyosalpinx. This is the right ovary. So I will not label it as a case of tubo-ovarian mass, cystic mass on the right side, but on the left side I can say that because ovary is not seen on the right side. So this is the, now this is the breach in the capsule. This is the outer capsule of the right ovary, and this is the breach. And thus this is a case of bilateral Pyosalpinx, right side. On the left side, see, this is the left side, and on the left side we do not see any, we do not see the ovary, and though the uterus is seen in terms, this is the longitudinal section. To give you both structures together, now this is the left one, and this is the right one. This is the uterus below, and here comes the right one. And You can also see the ovary along with this. So this is a Pyosalpinx, bilateral Pyosalpinx. This is right cyst, right adnexal cyst. This is left adnexal cyst. This is the ovary. This is the right ovary. Left-sided ovary is not visualized by transabdominal ultrasound, and thus this is a case of bilateral Pyosalpinx and not ovarian cysts. Both fallopian tubes are dilated, filled with echoes. Now let's see if there is any mass effect on the kidneys, on the ureter or kidney. Let's see that. This is the right kidney. It's absolutely okay with it. No hydronephrosis seen. This is the This is the left kidney, and the left kidney is also showing normalcy, no hydronephrosis. Now you see there is no pleural effusion. This is the left hemidiaphragm, no fluid seen anterior to the diaphragm. This is the right hemidiaphragm, no fluid seen anterior to the diaphragm. This is the right hemidiaphragm. So no pleural effusion on either side, and in such cases should see that if there is any evidence of para-aortic gland and lymph nodes. Now you see that this is the aorta, a longitudinal superior mesenteric artery rising, celiac axis arising, and this is the transverse section of the pancreas. The pancreas, superior mesenteric artery, aorta, IVC, no lymph nodes seen, and these are the left. Now these are the left iliac vessels. No lymph node enlargement is seen on this side, and here we will see the right iliac vessels. These are the right iliac vessels. No adenopathy is seen. No regional adenopathy is seen. There is no fluid seen in the pelvic cavity as well. This is the uterus in longitudinal section, and this is the uterus in transverse section. No fluid seen. So this is the case of the day. Thank you very much.